Hi, my name is Kirk Hamilton, your host of the Staying Healthy Today show. This is a show where we're bringing you key experts in the fields of nutrition, prevention, integrative and lifestyle medicine, review the medical literature, and we review case studies. Today's show topic is testosterone therapy for men, the hype, who needs it, and how to increase your own production of it. I just got finished doing I think it's one of my favorite interviews with a Dr. Gary Huber from Cincinnati, Ohio. He has a clinic there called the Huber Personalized Medicine Clinic, and he was board certified in emergency medicine, practiced that for 20 years, and in the last 10 years he's been doing integrative medicine. And I heard him lecture at a recent conference on anti-aging medicine, and he gave a great talk on testosterone, and there were so many things that rang true for me in my experiences that I've found it hard to find anywhere else, that I just wanted to interview him and pick his brain. So this is a loaded podcast, and I encourage you to listen to all 57 minutes of it because it's chock full of clinically relevant information that can help both the practitioner and also the layperson get good quality care. So it starts off, one of the great debates is that people measure hormones in different ways. And when you give a cream of either progesterone, estrogen, or testosterone, if you measure it in the serum, you're not going to get a level to rise in the blood unless you use a very large dose, a supraphysiologic dose. So one of the things I wanted to ask him, because he happened to use saliva testing for creams, which probably most doctors don't, some are moving over to that, is because that we know that what happens is if you do both at the same time, which I have done. I did serum and saliva testing for almost 2 years on every patient that walked through the door. And what I observed was the hormone level, let's say testosterone, would go up in the saliva relatively quickly, and in the serum it wouldn't go up unless you used very large doses. So it turns out that I asked him the same question. He started getting into the hormone business using progesterone cream in females. And he observed the same thing. And what happens is there's a study by Dr. Chang in the 1990s which showed when people were going to go get their breast biopsy lumps taken out, they were given radioactive tracer progesterone. And lo and behold, they were also assessed for serum levels. And after 2 weeks, there was lots of progesterone in the tissue, in the breast tissue that was biopsied, but the serum levels didn't come up. And practitioners have observed that over the years. And it has to do with the physiology of what happens to the hormone that goes on top of the skin. And by the time it gets to your venous blood, it's gone to different metabolites and different things have happened to it. So what happens is that physicians, if they're bent on using serum levels for assessment with creams, whether it be testosterone, progesterone, estrogen, are going to keep giving a dose until the blood level comes up, which is superphysiologic. And then what happens is you can get what's called a tachyphylaxis, or I call it a dulling of the receptor sites. Receptor sites have to fill up for hormone and then empty. If you give too much, they just kind of null. They don't work anymore. And so what you observe and what he observed and what I've observed, especially when I originally got started in this, so you'd start off with, let's say, a male only produces, I heard originally 4 to 7 milligrams, and Dr. Huber says 5 to 12 milligrams of testosterone a day. So then why are you trained to give 25 to 50 milligrams or sometimes 100 to 150 to 200 milligrams a day of testosterone cream? It makes no sense. Well, what happens is you get an attenuation. So the person will get a big kind of hit at the beginning, and then all of a sudden, 2 weeks, 4 weeks later, they just won't be getting the same effect. So what does a doctor do? He gives more hormone. And that's exactly what you shouldn't do, because that receptor site is dulled. You're giving way more than the body produces it on its own. And so then what happens is you don't get the benefit, and also you may get some adverse side effects that aren't severe, but extra estrogen production and conversion to other metabolites. So it's very easy to see this if you'll do saliva levels with cream hormones. Now, when you're using injections, let's say we're going to stay with the males for a moment here. We produce 5 to 12 milligrams a day. When you give 70 to 100 milligrams a week of an injection, that's more physiologic, about 10 milligrams a day. And that split it in a divided dose gives a nice level. It doesn't spike too much, and you get a good result. So with testosterone injections, you can use serum levels. But with testosterone in a cream, you use saliva levels. And interestingly, Dr. Huber went and challenged to the big drug companies who say that it's kind of like a 10% rule, that 10% gets absorbed. Well, when he challenged these two drug companies who make these topical gels and other topical agents for testosterone, they couldn't come up with any studies that showed this absorption. So the foundation is based on not good science at all. So the moral of the story is that he sometimes will use, and here's another key point, you don't want to give more than your body produces because then you suppress your own production. So in very young men, sometimes between, let's say, 40 and 60, and they might be low in testosterone, there's a variety of reasons we'll go into, he might give 2 to 5 milligrams a day just to gently bump up that level but not suppress the levels. And he found out that if you give the lower doses, which seem very low to a lot of doctors, that you can actually, with lifestyle and that, increase your own production. So the number one thing in this interview is if you use creams and you're going in higher doses, whether you're a female or male, you might want to get somebody who knows what they're doing with saliva testing to adjust the cream dose. If you're using shots in a male, then serum levels are excellent. Now, what's even more important about the discussion that I had with Dr. Huber is he really works on trying to not give you testosterone or not give it early enough, but improve your own production. And it's been shown that since the 1980s or 90s, that men in the 1980s have lower testosterone levels than we do in 2016. And so we haven't evolved that much. And what may it be? Well, it may be environmental toxins, like what comes from plastic, polyphenol A's. And there's many other compounds that come from these plastics. But they can cause all kinds of anti-testosterone effects, from reducing secretion to binding, all kinds of problems. So one of the things is, obviously, we don't want to, everything's in plastics. So we want to try and get away from those. But we're also in more toxic environments with pesticides and herbicides and non-organic foods. And all these things affect how we produce testosterone. And the other thing is stress. Remember, hypothalamic pituitary axis. That's where the messenger comes down to tell the testicles to put out more testosterone. So more stress, lack of sleep. That's my biggie. Okay, lack of sleep, for whatever reason, doesn't allow your body to secrete its normal amounts of testosterone and other hormones. Being overweight, eating sugar. So there's a list of things he gives in this interview that are highly pertinent that will help you, even if you never take testosterone, to help produce more of your own. Then he uses some unique therapies. He talks about Clomid. Clomid is a drug that's designed to help with fertility, male and female infertility. And Clomid, what it does is it blocks the estrogen receptor sites on the hypothalamus, so your hypothalamus secretes luteinizing hormone and follicle-stimulating hormone. And these hormones, follicle-stimulating hormone, helps make more sperm. It stimulates the testicles to make more sperm. And luteinizing hormone stimulates the testicles to make more testosterone. So this is another thing he uses, sometimes 2 times a week, sometimes 3 times a week, to help, along with lifestyle, to help a younger man, maybe 40 to 60 years of age, produce their own testosterone. And if you can do the lifestyle changes, sometimes you can taper off the medicine in 6 months to a year. This is very hopeful, very good thing. I love the way this guy uses hormones, because we're not using hormones to just absolutely replace and suppress your own production. We're trying to always enhance your own production and sometimes get off of the hormone. In closing, he talks about it. We'll ask about the risk factors. So prostate cancer, it's just been way overblown. Testosterone does not cause prostate cancer. In fact, those who get prostate cancer with higher levels have less invasive forms of prostate cancer, and they live longer. The thing about heart disease is he even feels stronger about the evidence that testosterone helps support your vascular health, from reducing your risk to diabetes and hypertension and metabolic syndrome, and helping lean out and being a vasodilator of your blood vessels and reducing C-reactive protein and many other reasons. It just doesn't hold water that testosterone increases your risk to cardiovascular disease. And we closed on one thing that we both agree on and we kind of experienced in different ways, is that his dad was an 85-year-old male who was really declining. And he wanted to put him on the cream, but his dad just wouldn't be compliant with it. So he put a pellet in and gave him a steady dose of testosterone. And the dramatic improvement in his health and well-being and energy and physicality and functioning at 85 was tremendous and just life-giving. He believes his dad would be dead by now. And I shared with him a 100-year-old patient of mine who I give a testosterone injection with some B vitamins every week, and it's a like a light switch. So I think, like he does, that testosterone therapy in older men, maybe by shot or injection or whatever, may be even more valuable. So there's lots of clinical pearls in this review. I highly recommend you listen to it, whether you're a practitioner or whether you're a lay person. You'll get a lot, because if you're a lay person, you need to be able to go talk to your clinician about how he's assessing you, and ask them, if they're giving you large doses of a hormone, why are you not giving closer to what our body gives out, especially if you're a male. It's real obvious. Okay, we only produce about 5 to 12 milligrams a day, or I heard 4 to 7 milligrams a day, but it's not very much. And then why are the doses so much higher when we use creams? I've had one physician who taught courses 200 milligrams a day. Okay, so my name is Kirk Hamilton. This is Staying Healthy Today show. All the links to Dr. Huber's website will be there. Links to my website. This will be put up on iTunes. This is a really good one to share with your health professional or people you care about. I'll talk to you soon, and you have a fabulous day.